Hello, I'd like to welcome everyone. Thank you for being here. My name is Adam. I'm a volunteer with Clear Skies Ahead. I'm a current airline pilot, and I was able to return to flying after a very protracted process to get my medical back. Today we're talking about choosing your HIMSS AME and the special issuance process. It's something that I know personally a lot about just from personal experience. It took me a long time to get my medical back. I'm proud to be flying today. I wish when I started this process that I had resources like this available to me. When I was going through the process, I looked and couldn't find anything, and that's one of the reasons that we're creating these seminars. We're sharing with you mistakes that we made, and sort of hoping that we can help the next group of aviators going through this process, the time and the mistakes that we made. Um, I will be sharing my story on a future one of these sessions. So we're really glad that you're here today and you chose to spend the hour with us. The webinar today is hosted by Clear Skies Ahead, a nonprofit organization dedicated to improving the health, safety of aviation professionals and enthusiasts through research, education, and support. We advocate for improvements in the aeromedical system. We also believe safety depends on cultural change within aviation, where health and well-being are treated as foundational, not something to be hidden or delayed. A quick clarification before we begin. Today's discussion is provided by people that have been through the HIMSS process, just like myself, and are voluntarily sharing information for education and informative purposes only. Clear Skies Ahead does not provide one-on-one consulting, medical advice, legal guidance, or individualized case review. This is the second session in a structured 12-part webinar series designed specifically for non-airline aviators navigating the FAA medical certification process, specifically related to mental health and substance use. We do have to give you a quick note on why the term non-airline aviator. This is a term that we had to coin recently from CSA. The HIMSS process, specifically as it relates to addiction, has been created for airline pilots. And the FAA does not make much distinction between airline pilots in HIMSS and non-airline pilots in HIMSS. Both groups of people may have to go through the same process. Airline pilots probably have it easier because they have a union and the company standing behind them. The group of pilots that we're sort of speaking to tonight, non-airline aviators, includes student pilots, GA pilots, Part 91, Part 135, charter pilots, egg pilots. Something I learned recently, drone pilots have to have medicals, as do air traffic controllers and DOT positive terminated pilots. So non-airline aviators, that really does encompass a whole lot of pilots out there. Something we say at Clear Skies Ahead, every airline pilot starts out as a non-airline aviator. Before we dive into today's topic, this slide outlines all 12 sessions in the series, so you can see how this one fits into the bigger picture. Our website, clearskiesaheadnonprofit.org, serves as the central hub for this series, hosting recordings, supplemental reading, and practical tools that expand on each session's content. This series focuses on parts of the FAA HIMSS special issuance process that are often unclear or misunderstood and provides the background and resources aviators need to navigate them. Session 1 is available to view on our website. That is recorded. This session will be recorded also and available as a future resource on our website. Over the next hour, today's format will include a personal story, a brief educational overview, and a moderated Q&A panel. Clear skies ahead. We believe understanding the system starts with understanding lived experience. As such, we believe storytelling is an essential part to healing. It helps listeners recognize shared experience and reduce stigma while giving storytellers a way to process their own journey and help others through what they share. Our speaker tonight is Luca. She is a non-airline pilot who made the decision to self-disclose her past substance use before any external event or enforcement action. She is going to share her story in the spirit of what it was like, what led her to take action, and what it has been like navigating the FAA SI process. Luca's story isn't shared to prescribe what anyone else should do, but to offer understanding and connection, to remind us that behind every policy and process is a person. This is the human side and the impact of the process. Luca, thank you for being here and for being willing to share your experience with us.
Thank you so much, Adam. Yeah, I unfortunately only learned about clear skies, I want to say like about a month ago. It would have really helped me navigate through the special issuance process. A little bit about me, I'm currently a flight instructor at Centennial Airport. And about, want to say about a year and a half ago, no, about 2 years almost, I overheard something in the flight school. It was a flight instructor telling their student, kind of a warning, like, hey, be careful if you see a therapist through insurance, they likely have to diagnose you so that insurance accepts and will pay for it. And I was like, oh, that's some new information that I've never heard before. And I was like, I've seen a few therapists from age like 21 to about 23. So I decided to do my homework and reach out to those therapists and just ask, like, did you guys diagnose me with anything? What was it? And I got the sad news that they had diagnosed me with substance abuse and substance dependence. I was 21. I was, yeah, struggling with kind of controlling how much I was drinking, learning boundaries and all that. They had also diagnosed me with like mild anxiety, and like temporary depression from a breakup. But the FAA didn't super harp on those ones. It was more the substance that they wanted to look into. Um, so I was nervous. I didn't really know what route to take. So I went on Reddit for advice, and they basically said, your career's over. It's going to take so much money, so much time, and the airlines won't want you when you're done with it. So that was terrifying, and untrue, that I found out later. So then I decided to get some help from maybe someone that knew a little bit more about the whole situation. So I reached out to AOPA and I got a consultation through them. And the guy on the phone kind of laid out like all the steps I had to take. I was like, okay, that's more understandable. I get that. And then he kind of laid out, he's like, if you're trying to decide whether to tell the FAA or not, let me tell you something. And that is, if you have an accident and you're expecting insurance, like the flight school's insurance to cover it, the insurance company would probably look into all of your medical records and they would probably be the one to find this. And then you know, if you had ever lied on a Med Express to the FAA or not disclosed something you knew, you know, you'd be in trouble with the FAA. You'd also have to pay for that accident because you technically don't have a medical. And so that really helped with my decision making. That and the fact that I was just thinking about it for a few days and it was causing me so much anxiety, really. Just like, what do I do? This all seems so awful. And I finally made the right choice and decided to just be honest about my situation. So I left my job as a flight instructor for a little while, got a different job, and then told my AME, like, hey, this is what I have in my history. I was seeing Dr. Dillon at the time before she retired, and she asked me the four questions that the FAA needs to ask about substance. I believe it's dependence is the really bad one. They're both not great, but And the questions were like, have you ever drank more to get the same effect? I was like, well, yeah. Have you ever, while intoxicated, drank more than you planned to? Yes. Have you ever had withdrawal symptoms? No. And then has alcohol ever like interfered in your personal life, losing a job, losing a partner, anything like that? And that was a no for me as well. Because I answered yes, yes to two of those questions. The FAA basically in their eyes, I was an alcoholic. So she was a great AME and she kind of laid out all the steps that I would need to do in order to get my medical back. And, she was honest that they would cost some money and they would take some time, but it is doable. So I kind of started down the path. We let the FAA know that I self-disclosed to the FAA. And then we started like doing random urine tests. I started attending AA and stuff like that. I had to then switch to another AME because she had retired. And that was Dr. Harris. And I kind of filled him in on my situation. And then the FAA got back to me and was like, hey, we need you to do a psychiatric evaluation. And so I looked into different people, different options. I picked someone that was close by, relatively cheap, about $3,000, and it had a decent reputation. That went well. That was just kind of telling him my whole history with alcohol, basically. And then after about a month, he got that submitted to the FAA. And then it was just kind of, wait around, see what happens. I never stopped, fighting to get my medical back, but sometimes there's not too much you can do. So we waited a few months to kind of hear back from the FAA. We weren't hearing anything. So I remembered what Dr. Dillon said, and she said, you got to do outpatient, like most likely, and you'll have to most likely do 90 and 90, so 90 AA meetings in 90 days. So I was like, I'll start with the outpatient. I've got a good job. They provide good insurance. It'll cost me my maximum out of pocket of 3 grand. And I have time after work to attend outpatient, which outpatient is basically like rehab, but you don't sleep there. So I attended that from 5 p.m. to 8 p.m. Monday through Thursday. And it cost, like I said, about 3 grand. About a month in, my insurance was like, why are we paying for this? You've been sober for, almost a year now, and you don't have any other like mental health issues. So they stopped paying for it. And then outpatient was like, well, would you like to pay for it? And I was like, I can't afford it. It's very expensive. So then I left. But I left after a month, like 28 days total there, and that's the magic number apparently that the FAA is wants you to attend outpatient for is 28 days at least. So then I moved on to 90 and 90. I got that completed. I said, I've improved, I've changed, I'm really deep into my sobriety now. Maybe I'll meet with the same psychiatric evaluator, get it like a re-up evaluation for about 500 bucks. And then we sent that into my AME. And then again, I was just kind of twiddling my thumbs, just like, okay, what can I do? And then I met with my AME because I wanted to see like where is everything in the progress of all this? Like, when will I be able to fly again? And I'm glad I did because it was in that meeting that he informed me, like, oh, I was just waiting for you to set up a meeting with me so that I could, see your progression and recommend you to the FAA to get your special issuance medical. And I was like, oh, that would have been great to know. I'm glad I scheduled an appointment, but wish you had told me that we needed to meet in order for you to recommend me. And so that was like called a consultation. I think that cost like 400 bucks or something like that. Um, so we got that. He recommended me. And then again, I was just waiting to hear back. So it took about 8 months from sending in my psychiatric evaluation to hear back from the FAA at all. And they said, hey, we want you to do a neuropsychological evaluation. And I was like, okay, all right, let's do this. The whole process is a lot of like hurry up and wait. You get a lot done. You work as fast as you can. And then you wait for the FAA. So I was expecting that again. So I scheduled the neurological evaluation as soon as possible. I went with someone that had a great reputation, and could back up, that the way she presents her findings to the FAA is what they want and what they accept most of the time. I met with her for about higher than maybe average, about 6 grand. I think you can do it maybe for 4 grand, but I wanted it done quick and I wanted it done correctly. So that was kind of just testing my brain, memory, quick addition, cognitive functions, all that. And then once that was over, we sent that in, and I was expecting to wait a while. But it was not even a month later that the FAA said, "All right, here is your special issuance." And I was just ecstatic. That was the best news I could have heard. So all in all, the process took about a year and a half, which I think I'm pretty lucky on that. I think a lot of them usually take 2 years, but I'm not sure. Every situation's different. And then it ended up costing me about 16 grand. Like I said, I, opted for maybe some people with more experience that cost a little bit more, in certain situations. And I got lucky with the outpatient using my work insurance. Um, but yeah, and then yeah, like I said, I got my special issuance, and it's been amazing. I was able to get my job back. Everyone's been, so kind about the whole process. I tell some people, and but not everyone. And uh, you know, it was frustrating because, like I said, it was a lot of kind of just hurry up and then wait for the FAA. And I didn't have clear skies ahead, so I didn't know if I was doing everything correctly. Um, and then another kind of frustrating part was just that AME not letting me know that we needed to meet again in order for him to recommend me. But that's just things you kind of learn along the way. But what helped me a lot throughout the process was honestly my sobriety. If the FAA hadn't required me to be sober in order to fly, I don't think I have would have had the motivation to kind of get my stuff together and pull that trigger. And my sobriety has given me so much freedom and just happiness and gratitude. So I wouldn't trade that for anything. Um, and yeah, the other things that kind of helped throughout the process was just never giving up and just trying to work through their steps as quick as possible. Um, Now on to like what could have helped me. That would definitely be clear skies ahead. I wish I had known some more information about the process, and I think they could have helped with that. I also didn't know about this thing called Birds of a Feather, which is like AA meetings for pilots. I didn't know about that till about like 6 months into my sobriety. And that could have given me some guidance. The pilots in there could have been like, hey, you're doing the right steps, keep your chin up, and enlightening me on their process as well. So those are just some things that maybe would have helped me sooner. But honestly, like going through this whole system, it was a little frustrating. But it's put me in touch with like so many amazing people, so many amazing pilots. Um, and their support has been, so helpful. And as you guys know, like aviation is a lot of like who you know. And now I know a lot of great sober pilots. So, it has been kind of a blessing in disguise. My advice for anyone listening is kind of just don't listen to Reddit. It doesn't always know what it's talking about. And never stop fighting for, your dreams. You can obtain this, or I can't, I guess I can't say that, but I also just wanted to add one last thing that the FAA doesn't really care about, any excuses you could, get out of your pockets and fess up to them. Like they don't care about that. Really, they just want to be able to trust you to fly around the general public. And I think that's some of the reason they do some of the things that they do, and the requirements that they have is they just want to know that you're safe and trustable. Um, and yeah, I just want to say that I'm really happy with the decisions that I made to tell the FAA. If I hadn't, I would probably just be, living in fear. And they could come after me at any time. And going forward too, like if I was lying on the Med Express repeatedly saying like, oh, I don't think I have any diagnoses, even though I knew that I did. I don't know if they would ever follow through with this, but technically it's like a federal offense. And they could come after me for like a $250,000 fine and like 5 years in prison. So that scared me also. But I'm really glad that I went the honest route. Um, Life is just so much easier. I have so much more gratitude for where I'm at in my flying. And I'm definitely not taking for granted like this amazing step that is flight instructing. I really enjoy it and I missed it dearly when I was going through this process, and it was worth fighting. It was worth fighting for. Um, Thanks. I think that's all I've got. Sorry if I talked for too long. Um, yeah, thanks for having me. Oh, I can't hear
So
you.
there we go. That was amazing, Luca. Thank you so much. I heard this is the first time I've heard your story, and there was so many commonalities and things that you shared with the process that I went through. Um, something that you gave Clear Skies Ahead some airtime. We appreciate that. And that's really why this we created this is those of us that have been through this process took a look at it and said, gosh, there's just no resources out there. There's resources for the physicians on the FAA website, but there's not a lot of resources for uh, those of us that are actually going through it. So really appreciate you sharing that. Um,
Thank you.
and I heard the frustration in there, and this process is certainly you're not in the process if you're not frustrated. And we're, by sharing this, I think we're hoping that we can save some other people from the mistakes that we made. It is confusing, it's opaque, so we're trying to put that information out there. Um, and just a little shout out, you mentioned the 8500 form. The next session that we are hosting is just specifically about filling out that form, resources on that.
Thanks.
We're now going to shift to the educational portion of today's session. I'm going to turn things over to Stephanie Day, who will discuss how to go about choosing an AME or a HIMSS AME. Stephanie serves as a general aviation representative to the HIMSS Advisory Board and has spent many years navigating the process personally and advocating for better education and transparency within it. Stephanie, whenever you're ready.
Hi, Adam. Thank you. And thank you, Luca, for sharing your story. Like Adam says, very relatable, in the highs and lows of the process for sure. And appreciate your vulnerability and being so open to share tonight. I have been in the industry for nearly 3 decades now. Initially as a flight attendant. Most of my career has been as a flight attendant, but I had always had a desire to be in the flight deck. And I uh, really just went along for many years, raising my family. And then in 2015, I decided that that was when I was going to take the steps to work my way over and from cabin to the flight deck. And that is when I realized that things that transpired in my past were going to show up. So that is kind of how I got started along the process. Like Adam, I'll share my story in more detail in a future session. Uh, as a flight attendant, I also was an EAP rep, an employee assistance peer, specifically for flight attendants. I did this as a way of being in service to my recovery. I have almost 10 years sobriety now. Um, and I am also one of the lucky ones to be dual diagnosed. I have had several diagnoses put on me over the years. And And so it has led me again to go through this process on the mental health side as well as the substance dependence side. So I've been able to see both parts and gain a lot of information. As an EAP rep, I did a lot of trainings and started my advocacy work along that route. I met Adam back in Washington, D.C. a couple years ago when we were both lobbying Congress with the Pilot Mental Health Campaign. And that was a great experience. We lobbied 2 years in a row. And I guess I just want to, I wanted to share that I am now the GA representative for on the HIMSS advisory board, which basically is just that I am a voice for all of you. So I want to continue to hear your stories, your experiences, and I will continue to advocate for improvements in our air medical system for mental health and substance use. So let's get into what we're talking about today. So I'm going to share my screen. And as I share, I'm also just going to be sharing my experiences along the way in choosing an AME or a HIMSS AME, because as my process, some of you also may have had this experience that had to go through a few of them. You are allowed to choose, and your choice is crucial to your application. So let's. So what's covered in this session tonight, we're going to just talk a little bit about what an AME is, HIMSS AME. Most of you know, but we're also giving some basic information for those who are really just starting this process. Some why the practices and experiences vary out there, how to assess AMEs, what questions to ask, and when and how you might change if that is needed. Again, as Adam also mentioned, we will not be going over how to fill out the MedExpress form. We're going to cover that next session, and that kind of deserves its own topic. At this point, we're going to say, though, if you have not submitted, if you're not in the process, you're just starting out gaining information, do not submit before you see your AME. Have a consultation first. We'll get into that. But what is an AME? An AME is an aero medical examiner that is designated by the FAA to conduct FAA medical exams, review your medical history, submit findings to the FAA, and they are allowed to issue, defer, or deny. Your AME does not work for you, but you are, they are your customer in a sense. Last session, I talked about the national airspace being the FAA's customer. We, the aviators, are the customers to the AME. And so we need to keep that in mind in just like any transaction, any experience that you go to, have a service, you want to pick the right service that is going to support you and give you the best service. You get to choose where you're going to place your money in your transaction. And the critical part is that the AME who you choose to go into partnership is they're going to be your representative to the FAA. So what is a HIMSS AME? A HIMSS AME is an regular AME. They have to have been an AME, and then they go to a HIMSS seminar to get training and will be designated then a HIMSS AME. They are commonly required for substance use history issues, certain psychiatric conditions, and they collect all the documentation. They should help guide you through this process. They monitor your drug testing for those of you for substance use. And again, they are going to be, we sometimes say, the quarterback of this team, because they're compiling everything, and they will make an assessment of you as well to the FAA, and they will submit your documentation. Not all HIMSS AMEs are HIMSS AMEs, and not all HIMSS AMEs have the same level of experience. So why is that? HIMSS AMEs are designated and trained the same. They have the same training. They all must be licensed medical doctors or doctors of osteopathy. Any specialization, though, as you may know, there have been some that are podiatrists. And so there is no specific category that they are required to obtain, or a classification. It can just, the classification is, the requirement is a medical doctor or DO. And again, they receive all the same training. They are required to do recurrent training every 3 years. However, how they practice is not regulated. So as you may know, most of you, or those of you who are just learning, what is not regulated is that they can charge whatever they want. They can spend as much time or as little time on cases. That is not, so each AME gets to decide how they're going to run their practice, and how much time and efforts they're going to put into their cases. HIMSS cases do require a lot of time on an AME's part. And so, that's something to take into consideration. Also, what is not regulated, or again, goes back to the specialization, is that most, I would say, of these doctors do not have experience or education in mental health or addiction. It's not to say that they are not compassionate or understanding, but I think I've always been told you can only understand what you have experienced. And so having that experience or education is really valuable if you're going to be evaluating somebody else's recovery or their case. So how do you go about finding an AME? There is a FAA locator search. I know you guys can't see this. These are websites. And these will be posted on the website. But so the FAA does have a public-facing AME list and a HIMSS AME list that you can go to and search by location. And basically, that's kind of how you search, is by location. It does not include any level of experience or how long they've been practicing. And the real fact of the matter is also it doesn't even state whether the AME is practicing, because once they go on this list, they actually do not come off this list. And or it takes, a lot of effort to get them off the list. I know this is something that the FAA is looking at and wanting to change, to put in place more testing possibly, or like evaluations on the training of AMEs, and then possibly, somehow they can remove AMEs that are not not practicing and stuff. But at this point, this is where things are at currently. So while you can find an AME, it's a good starting point. This is not a recommendation. So how do you go about really getting referrals and really finding somebody who is going to be the right fit for you? Great place is birds of a feather groups, pilot associations, your local flight schools. Another resource is aviation attorneys and consultants. Basically, as you start this process or are going through it, the more you're open and honest about what you're going through, the more you're going to find others who are in the process and that are willing to offer referrals and recommendations on who maybe you should see and who you shouldn't see. And, again, the best referrals are those that match your case. So in my experience, this is where I'll share some of my experience. I did have a consultation before I really started the process. But I'm sure some of you can relate to the fact that when I first started this process, I was really scared. I didn't know what I should share necessarily. I didn't know, how to move forward. In my case, I had been given an inaccurate bipolar diagnosis, and that is one of this disqualifying diagnoses by the FAA. So I knew that I needed to find somebody who was going to have some experience. I knew I needed to prove essentially that it was a misdiagnosis before I had any chance of moving forward in this process. And so I did move forward with one provider. Again, I just did all the work, really. And I was denied. And then when I started the process again, I started the process with somebody who had just gotten their HIMSS designation. They had been an AME for decades, but they had just received their HIMSS designation. And I thought, because he was referred to me highly, but not as a HIMSS, just as a regular AME, I thought that it might be a good fit, but then it turned out to be a very poor experience because of his lack of experience on the HIMSS side. And he basically told me that I would just be wasting a lot of money if I continued. And I realized that that was true because he did not believe that I could be successful. And so that's something to really watch out for, is you need to, again, you're forming a partnership with this medical examiner. It's going to be a years-long relationship that you are moving into, and you need to form the partnership with somebody who is, they cannot be your advocate, but you need somebody who is going to build the best case for you, because again, they are the ones who are going to be pulling all the documentation together and presenting it to the FAA on your behalf. So I'll say that the HIMSS AME that I am with today, who was it was a referral from a HIMSS peer. When I told him, talked to him, my first conversation with him, he did not bat an eye. He has been doing HIMSS for many years, and he was confident that if I do this, this, and this, that I, had a chance. And that's really what I needed to hear to restart the process and move forward again. So again, your AME choice. This is your choice. This is going to be your FAA medical translator. They're going to translate your case to the FAA. Your choice may impact timeline, costs, and stress. Like I said, this is going to be a long-term relationship that you are moving into. And it's also something to keep in mind that this is not your primary care physician. This is somebody that you are going to, that is basically evaluating if you are fit to fly an airplane. And although you may think that you are fit to fly, again, as we went over in session 1, this is a regulatory system. And so what is in your file? What is, we will talk about that more in a future session of, you really need to get your records and you need to know what's written in them. Luca talked about how she called her therapist and her providers and said, "Did you diagnose me?" I had to do the same thing. And when it's in there, the FAA is they're going to see it. They read every single thing that you submit. And so you need to know what's in there. But do not look to the AME to be your primary care physician. That is not their role. Their role is to evaluate. So we suggest that you schedule, before you schedule an exam, before you submit your 8500-8 form, the Med Express, that you book a consultation and that you go and you interview AMEs and ask them some questions. You are the consumer here, right? You are going to form this partnership that is going to be the bridge to get to your medical certificate. So you have a right to form this partnership with somebody that you feel comfortable with, that you feel is experienced and that has the aptitude and capacity to work with you and with your case. So these are some questions that you can ask them. A lot of times, I will say, we suggest do not fill out the Med Express form. A lot of AMEs, interestingly enough, when you schedule your first visit, they say, fill out your Med Express form before you come. I do not think that is a very good guidance, because once you fill out that form, you are now, you're basically starting the process. So you can pause and gain information and do a consultation instead. And as well, we want to also suggest another option, which is to consult an aviation medical attorney. This is also something I did along my way, but I do wish that maybe I had started with it instead of going to the AMEs as with a consultation. Because my case was so complicated, I probably would have done better by going to the attorney first and feeling a little bit more honest about my case and open to share with an attorney and getting some guidance there. it may be worth the consultation to go to an attorney, and they can also then point you towards some experienced providers. So red flags to be aware of is, if they're being dismissive, if they're disorganized, they're not current on policies, and just vague guidance. You need an AME who is going to give you some structure and not just put this all in your lap and say, go do it. The other thing I don't think I've mentioned yet is that a lot of AMEs, again, they are really trained to work with airline pilots. So some AMEs have very little experience working with the non-airline aviator. And so that is something to keep in mind as well. So when it might be time to change the AME, again, if things are feeling stuck, poor communication, if you're just feeling like this is creating more confusion, and if paperwork is continually being dropped, you are like a lot sometimes that you'll get letters back from the FAA and they'll say, I didn't receive this. And you'll say, well, we sent it. And so that has happened a few times as well. Especially though, if you're stuck and just going in circles, a fresh perspective with a new AME might be what you need. So how do you go about changing AMEs before the FAA? Sorry, this should say just a regular AME. If you're seeing an AME, you can change freely. Now, if you're seeing a HIMSS AME, but you're before the special issuance, before you've received your special issuance, you can also change your AME, HIMSS AME freely. After your special issuance, you have to request a change through the FAA. And also I wanted to put in here, if you have serious concerns about the AME that you are seeing, please consider contacting the Federal Regional Air Surgeon to file a complaint or file a congressional inquiry so that this creates a record and accountability. So a cost, I want to get to Q&A. So most of you know that this is a very costly process. Some AMEs will offer free consultations. Some will also charge further consultation. HIMSS cases are expensive and timely. So if cost is a concern, which it usually is for all of us because we're paying out of pocket and insurance doesn't cover, you can ask, you can talk to, how many times have you talked to a provider or service, your dentist or doctor or, and just to see about payment plan, being put on a payment plan or other options. So just key takeaways from the session is ask for consultation. Experience and communication is vital. HIMSS AMEs are required for substance use, psychiatric cases, costs and timeline, ask upfront. Most importantly, choose your AME wisely. It's your choice and change if needed. So what's next? We have our next session, March 18th, 2026. It's called Before You Submit. Again, we'll be talking about the MedExpress form and disclosure requirements. So please join us for the next session. Thank you for listening, and I will send it over to Adam again.
Thank you, Stephanie. I wish I had that information before I chose my AME. I was actually trying to change AMEs, and I did one of the consultations with the AME, and I asked him how much it was going to cost, and he gave me the most exorbitant price you could imagine. And I was so glad that I had not filled out the 87 or the 8500 form, because then I would have been committed to that doctor. I ended up walking out of his office. So that's really good advice. Um, One thing that I would mention that I wish somebody would have sat me down before I chose my AME is keep in mind this is a long relationship. After you get your SI, you did mention that you can change doctors, but true to the FAA, I don't think it's easy to change doctors. And I've been seeing my AME, I think, going on 9 years now. So think about that when you start choosing that doctor, that it's not just you get your SI and you're done. This is a very long-term relationship that you're starting. So thanks for that great information. We'll now move into the question and answer portion of the webinar. Luca and Stephanie will be available to answer questions or comments. Before we begin, just a few reminders to help us stay within the scope and make this useful for everyone. Please keep questions rather general and not case specific. We're not able to review or advise on individual medical situations. If your question has more than one part, please ask them separately. Tanya will help us monitor the chat and questions, and I'll guide the discussion and step in as needed to keep us on track. If we need to redirect a question, it's simply to make sure the space remains educational and appropriate for a group setting. Begin, any questions from the audience? I've got one question coming in. The question, let me see, I'm just reading it here. Do I have to use the AME closest to me? I'll answer that one because the guy that gave me the very high price was the AME closest to me. And I chose not to go to the one closest to me. But go ahead, Stephanie, is that the right question for you?
Yeah. I think a lot of times we want to go to somebody that's close by. My AME that I'm currently with is also in another state. And so, thankfully I do work for the airline, so that makes it a little bit easier. But again, you really have to evaluate experience and the if it's going to be worth it for you to just go to the one down the street or take a little more effort to go to somebody a little further away.
I would say go to there's not a lot of HIMSS AMEs. Do you know how many there are, Stephanie, in the country?
I I was going to get that information and I failed. I'm sorry, but I want to say there's only a few hundred still.
That's okay.
Um, and as far as actually practicing and experience with non-airline GA, probably even less than that.
Okay. Just grabbing another question here. Do I have to stay with the first AME I see? I think we've answered that question. Can I switch?
We did cover that.
Yeah. Can I switch AMEs in the middle of my certification process? Possibly switching is, let's see. Okay, can I switch in the middle of my certification process?
Yes. So again, if you are pre-special issuance, you can switch. So before you've received your special issuance, you can decide again, like if you're stuck and things are not moving, and you might need a fresh perspective with a new AME. And so you are allowed to switch without any consequences. It used to be that, the FAA called it doctor shopping and didn't look on that too keenly. But now they're starting to understand what's really happening out there. And they say, vote with your feet, which means you get to decide if you're going to walk into that office or walk out. And they know that not all AMEs are created equal. They aren't regulating how they're practicing. So we get to decide as consumers and aviators in this process.
Thank you. Uh, What reasons are acceptable for the FAA to change HIMS AMEs after SI?
Well, I'm going to defer to Adam on that because he did just go through this process pretty recently. So I think he could answer that question.
Um, my story, my a lawyer recommended to me. I live on the East Coast, and my lawyer recommended to me to see a doctor in. I don't want to give away the state because there's not a lot of doctors there, but I'll say in the Midwest. Um, so every time I go to see my AME, I buy an airplane ticket because I don't want to go standby, and I fly to this city in the Midwest. And I've been doing that for many years, and it's really taking a toll on me. It's expensive. It's one of my few days off, and then I have to go to, it takes a day or possibly 2 days to go see that doctor. So I have requested with the FAA to change to a doctor on the East Coast. Um, so hardship, I think, for me, is just I've communicated this to the FAA, but I would say once you have your SI, it's not necessarily an easy process. It is not just stop seeing the doctor and start seeing the new doctor. You do have to coordinate through an official process with the FAA. You have to coordinate with the new doctor. They have to get your file from the FAA and pick up your file, review your file, and then the two doctors have to coordinate the handoff. And there was an error made in my process of when I was doing it, and it turned into kind of a big issue. So now I'm still trying to change my AMEs, but I'm really managing the process and just being very, very specific about it. And when the change actually does come, I'll be communicating that directly with the FAA. So that's my reason is just it took me so much time to go see my AME. I think cost. I think some people choose cost, some people move, some people transfer to different companies. So I think there's logical reasons why people want to change AMEs.
Yeah.
Um,
Um, actually did want to answer this question really quick as far as um, somebody asked if an AME doesn't ask many questions and defers to Oklahoma City, is that a red flag? And the reason why I want to ask that or answer that is it may or may not necessarily be a red flag, but what I do want to say that I don't think I did is that I've been talking about the level of experience matters, but not just experience, it's also the level of risk that an AME is comfortable with. Meaning, are they comfortable, you know, signing or referring you, or are they going to be, more cautious? And so that's again, it's you're building a relationship of trust with that provider, so that they feel comfortable to recommend you to the FAA.
are there any? I've just got a note that we've got 2 minutes left of the meeting, and I've got to read us out of this meeting. Any last minute? I will say I think Stephanie and I are easy to get a hold of. Clear Skies Ahead. You can certainly find us on Google real easy. Um, as we wrap up today, thank you all for being here and engaging in this important conversation. A special thank you to Luca and Stephanie for sharing your experience and insight. Your openness helps bring us clarity to a system that can often feel confusing and isolating. Clear Skies Ahead believes that improving aviation safety requires more than regulatory change alone. It requires cultural change, one where health and well-being are treated as foundational to safety, not something to delay, minimize, or navigate in the shadows. I want to briefly highlight resources available to you beyond today's session. Our website, Clear Skies Ahead Nonprofit, specifically under the tab medical, sorry, that's clearskiesaheadnonprofit.org, specifically under the medical certification info tab. serves as the central hub for this webinar series. There'll be 12 of these type of webinars. There you'll find the recordings of the sessions expanded with educational content and tools designed to help you prepare and think at your own pace. In addition to educational resources, Clear Skies Ahead also supports connections. First one that we'll talk about, Birds of a Feather, that's a AA 12-step recovery community. They have lots of meetings. I think there's 3 or 4 meetings a day, and there's hundreds of people that attend those meetings. As you guys know, I travel for a living, and I can often zoom into one of those meetings when I'm in a hotel room. Luca mentioned Birds of a Feather. And then Fellow Travelers is also another meeting based on Principles of Emotions Anonymous. It's a community for aviation professionals and enthusiasts who are navigating stress, uncertainty, or major transitions in life. It's not a treatment program or a certification resource. It's simply a space for honest conversations and shared understandings. I think the lawyer might have written this one. Just a quick reminder, today's discussion was meant to be educational. FAA requirements and processes can change, and everyone's situation is a little different. Be sure to check current official guidance and work with the appropriate professionals when making decisions about your medical certification. Our next session, before you submit, focuses on discussions that often have the most significant long-term impact. We'll discuss the Med Express Form 8500 and disclosure requirements. That's a real important session, understanding what we're signing out for when we're filling out that federal form. If you found today's session helpful and would like to support our mission, we'll share a QR code link linking directly to our donation page. Every contribution helps us to continue this work. We're all volunteers here. We're doing this, and we do have some expenses. We got to host the website, and we attend conferences, so we'd love your support for that. We're also looking for more voices. If you'd like to share your story in a future webinar as part of our short 5 to 7 minute opening segment, we'd love to hear from you. These stories will also be shared on YouTube and other platforms to reach more aviators. I'd like to thank you all for being a part of this community and for helping move aviation culture in a healthier direction.